So about 417 healthcare workers in the Eastern Cape have tested positive for COVID-19 between November and December. These include hospital staff, clinics and EMS personnel. The health department in the province says the rise in cases has affected operations at healthcare facilities. The department says the rise in cases is hugely driven by the Omicron variant. Now, the department also says that unfortunately, most clinics and hospitals remain functional through staff reshuffling. However, leaving remained staff with the burden of attending to more than normal patients. And several other hospitals and clinics had to close temporarily to allow staff the 10-day isolation and recovery period. Now, to give us an update on this matter, we speak to the Eastern Cape HOD, Dr. Rolene Wagner. Good morning, Dr. Wagner, and welcome to the show. Let us just start off with which facilities then are we talking about that have been affected?
Good morning, Sefo. Thank you very much for having us on your program this morning. So most of the healthcare workers that were affected, if we look at the top 8 hospitals that were affected, they came from the western part of our province, so Livingston Tertiary Hospital together with Dora and Ginza Hospital, as well as the central part of our province, which is your Livingston Hospital, Sisina Makiwani. And then in the eastern side, we had Nelson Mandela Hospital and the Mthatha Regional Hospital affected. In some instances, we had over 100 of our healthcare workers at one of those top 8 facilities affected. In the clinics, it affected our clinics in a different way. At the clinics, we don't have the same staff complement as we have at hospitals. And so at our clinics, where you have 1 or 2 professional nurses manning the clinic, when one is positive, we had to set the balance of the staff in quarantine. And so temporarily, we had clinics sporadically across particularly the central part of the province that had to be closed for a few days as the isolation and the quarantine periods were completed. Fortunately now with the new protocols, it allows some of our staff to come back earlier. Most of our staff have been mildly ill or even asymptomatic. So it was only when we were doing the screening and testing of those who had come into contact with confirmed positives that we identified that our healthcare workers were positive. And so in the previous policy, it really impacted our ability to provide services. With the amendment now from the National Department of Health, many of our healthcare workers who are mild and asymptomatic have been able to return because they've now completed the 8 days isolation period. Also, the changing in the testing protocols has now also meant that we do not necessarily screen everybody who is asymptomatic. So these changes have allowed us in the last 24 hours to bring some of our healthcare workers back. And that's had a positive impact on our services. At this point in time, we have 1 clinic that has been reported to us. As of last night to this morning, we did not have enough staff to cover the MOU. That's our maternity obstetric unit at that community healthcare centre in East London. But as of this morning, we were able to find staff who could now come back and provide relief. So the service has been restored this morning to a 24-hour service. Fortunately now, the rest of the province, at our hospitals and our clinics, we have adequate staff. We've either had to recall staff from leave or we've rotated them because it's the festive season. The outpatient departments have been closed across the Christmas period and the New Year period. And so staff from our outpatients have provided relief in our wards where we had some pressure of many healthcare workers that have been affected.
Now, Doc, what impact then will this actually have on the trauma unit specifically, especially as we head over into that New Year's weekend? I mean, we do know that often that particular weekend has got quite a large number of trauma cases that you see.
Yeah. So the casualties affected in a number of ways. As you're saying, it's the first point of entry to our facilities. And we have found, incidentally, that it is the casualties at our hospitals that have been most affected. I suppose this is also where our casualty staff come into contact with patients on an increased, quite a frequent basis by nature of the work that they do. So we have found that in casualties, we can expect to have slightly longer waiting periods where we've had challenges around our staffing. And we really do ask our communities to please bear with us. Our staff are doing the best that they can under the circumstances. It differs from facility to facility. So 2 weeks ago at the Nelson Mandela Academic Hospital, our neonatal unit was affected, the staff in the neonatal unit. And so we could manage the patients that we had in-house, but we had to divert any new patients to another facility. Similarly, at Livingston Hospital, the surgical department was under pressure, and we had to revert to only managing our urgent cases. Our elective cases had to stand down until the staffing was restored in that particular unit. Casualties at Sasila Makiwane have also experienced pressures. So the increase in pressures are twofold. Across the festive season, we do have an increase in the number of trauma cases, as well as the fact that we're finding many of our patients who are testing COVID positive are incidentally positive. What I mean by that is that they are being admitted for either trauma or a medical condition, another medical condition, and in screening them for COVID, we're now finding that our patients are actually COVID positive. So in other words, it's mild or even asymptomatic COVID, not being aware that they had COVID, but actually came in and were admitted for something else. But now this required us to separate them from other patients. And so we have this increase and the change in the kind of patients that are coming into our casualties. And at the same time, our ability to meet the demand for services were affected by healthcare workers being in quarantine or in isolation themselves. We're now finding, as I said, with the changes in the policy around quarantine and isolation, that has allowed some of our staff to come back. But we've also made contingency measures, as I said earlier, of bringing staff back from leave, reshuffling within an institution in order to provide relief. And we were not able to do so at small facilities like clinics. We have diverted patients to the nearby clinic to provide relief for that temporary period where our clinics were affected.
Now, you've mentioned the issue, of course, of recalling staff, those that were on leave. Just give us then details. Do you think that as a province, you are then ready for this fourth wave? We've often heard how health departments have said that they are definitely ready to tackle this fourth wave. Is this the case then for the Eastern Cape?
Yes, I think that we've been prepared, as prepared as we could be. Where we found that healthcare workers were affected across the province, those infections commonly match the rate of infections in our communities. So that was the first observation. Our readiness refers to the numbers of beds. So even though the numbers of active cases have increased significantly, and we are concerned about the numbers of active cases and the number of new cases that have increased rapidly across the last 2 to 3 weeks. But what we found is that the hospitalizations have been lower than in the preceding two waves. And so our bed capacity, all of our hospital admissions are well within our bed capacity. We've also found that those who have been admitted, we've got very few in ICU. And so at the moment in the province, out of our 900 admissions, we have around 17 in our ICUs, most of those coming from the private sector, and the public sector only having 1 patient in our ICU. So we've been really well prepared with respect to the numbers of beds available to be able to isolate, quarantine our COVID positive patients from other patients. We have been adequately resourced with our PPE supplies, our medication, etc., and even from the staffing. As I was saying, it's when your staff incidence starts matching the community incidence that you have pressure on your staffing. Fortunately, we've not had to recall many people back from their leave. It's been at isolated facilities, as I was saying, in the top 8, when you have an institution like Livingston Hospital having just over 100 healthcare workers who are infected in either quarantine, in isolation because they're infected, or in quarantine. In those instances, we've had to consider recalling staff back from leave. But in the main, we're very fortunate that hasn't had to happen across the province.
Dr. Wagner, just finally for us, of course, we do know that government continues to encourage people to take the COVID-19 vaccine. What are you doing as the Eastern Cape Health Department to ensure that more people are inoculated during the festive season? And also just your final words then for those who are in the province or will be visiting in the coming days.
Yeah, thank you very much. So as much as the infections rates have gone up, well, there's a belief that in our province, the fact that many people have natural immunity, but also that they've been vaccinated, is protecting them against severe disease, hospitalization, and deaths. So we really do need to encourage every person to be vaccinated. In our province, we were aiming by the end of December to have vaccinated 70% of our 4.9 eligible persons. At this point in time, we've achieved 74% of that 70% target. So we've really made an effort as a province to try and encourage persons to vaccinate and then to take vaccinations closer to where people are. It is really important to be vaccinated because even as the numbers go up and even as the hospitalization percentages are low, the more people who become infected, it increases those who are at risk of being hospitalized. And the persons who die are those who are at risk. And so the only way for us to protect ourselves as a community is to vaccinate as many people as possible. As we were saying, we were aiming for that 70% of eligible persons in our province. The vaccination amongst healthcare workers, we've had the booster program in place. We've vaccinated over 22,000 of our healthcare workers. It's just under half have received the booster, but we do need our healthcare workers to also be vaccinated in order to protect themselves from reinfection.
Thank you so much. That was the Eastern Cape Health HOD, Dr. Rolene Wagner. Of course, just a reminder that, it's important to get that vaccine, but she was really speaking around 417 of the healthcare workers in the Eastern Cape contracting COVID-19, but measures have been put in place to assist those that need assistance at these hospitals.